Hello, I'm Dr. Azhar Alam, consultant GI, advanced laparoscopic and laser surgeon. And today we're going to discuss about a very common issue known as constipation. So what is constipation basically? There's a lot of misconception, misleading facts about constipation. So constipation is defined when you have less than 3 bowel movements per week. So basically that is when you pass stools less than 3 times, then you can say you have constipation. Along with it, there is a spectrum of other symptoms which include in constipation, like having hard, lumpy, dry stools, painful and difficulty in passing stools, as well as a sensation of incomplete evacuation of stools. So all of these form part of the spectrum of constipation. How common is constipation? It is estimated that out of 100 people, 16 people are known to have constipation. And above 60 years, this increases to 33. So in the population age group above 60, out of 100 people, every 33rd person is supposed to have constipation. People commonly ask, how can we prevent constipation? So the first 3 important tips to prevent constipation is: number 1, drink sufficient water; number 2, drink sufficient water; and number 3, drink sufficient water. The estimate of water normally is what your body weight is divided by half in ounces. And roughly we can say an estimate of 2 to 4 liters of water per day is sufficient for your body. The next method to prevent constipation is having a diet having high amounts of fiber. So what are the types of fiber? These includes fruits, vegetables, whole grains and nuts. The recommendation is for men around 40 grams of fiber per day and for women around 30 grams of fiber per day. And you have to limit the amount of red meat you are consuming, because red meat forms as part of the staple diet, but we recommend to reduce red meat and increase fruits and vegetables in our diet. The next way to prevent constipation is to have an active lifestyle. When you do regular exercise, then the bowel movement, the intestinal movement also improves, and that results in much smoother passage of stool. So there's a lesser chance of you having constipation. How much exercise? We recommend 30 minutes of exercise for 5 days a week. That is the normal recommended amount of exercise which every healthy individual needs to follow. The next way to prevent constipation is to decrease your stress levels. There is a definitive connection between the brain and the intestines. So whenever you are suffering from stress or anxiety, there are signals which are passed from the brain to the intestine, which results in constipation. And the last method, which is the most ignored, is when you need to go to the washroom, go to the washroom. We have a tendency to delay the passage of stools, to delay bowel movements. So the tip here is that whenever you feel the urge or the need to pass stools, please urgently go and pass stools. So these are the ways in which we can prevent constipation, and we have to remember that constipation is one of the most important causes for a number of colorectal diseases. So if we can prevent constipation, we are preventing the diseases as well. Thank you.